Our next presenter will be Ben Seymour with Southworth Associates.
I want to thank you guys for asking me to talk today. It's an honor to get to do the work we do with the LAP and the lawyers, and I'll admit that dementia screening really freaked me out, because really it's all alcoholism, all the stuff they listed, poor judgment, loss of memory. I'm like, man, I identify with all these things. So today I'm going to talk about what we do and what happens when you call the numbers that we have on the brochures. And we have a great brochure. Some of that information is in the packet, but we have a brochure that circulates that has our information and talks about who to call in case you have a drug and alcohol problem. And that's the LAP brochure, and our information's on the front and the back of that. And we have a 24-hour phone number that we have, which goes straight to my cell phone. And so I'm going to kind of walk you through what one of those calls looks like, what would happen to an attorney who asks for help, or a judge, or if a family calls us and says, hey, my husband or spouse or whoever it is has a problem and we need help. So today I'll hit on intervention first. So we have attorneys come into our program in any number of ways. Typically what will happen is there's a phone call to me. So if a person calls or a participant calls, the first part I kind of go through with them is what are their external motivating factors, or is it completely internal? And so if there's a lot of internal motivating factors, that's a lot easier, because then the individual's got the motivation to change. I'm going to recommend some resources and we're on our way. It's pretty straightforward. If there's a lot of external factors, say they got in trouble at work, their partners are pressuring them, their spouse is pressuring them, then it can get a little trickier, because typically those individuals are going to want to kind of do the half measures. Example, I'll recommend, well, you should go do an evaluation so we know what's going on. Typically our professional evaluations need to be handled by a professional center where they do a specialized 3-day evaluation. We don't have any of those in Idaho. And so we would need to send them to a program to do that. And when I mention that, typically the resistant individual will say, well, can I just go to a counselor here, or go to my general practitioner? They'll offer some kind of other alternative solution that's a lot easier and far less effective. And I'll have to intervene with them and kind of talk them through the process and let them know, why it's so important to do that. I guess the first thing I should say is all calls are completely confidential with us. We don't release that information to LAP. We have anonymous ways that we handle that, so all calls are confidential. Again, I handle all those concerned parties. So the way that call goes, and I've participated in interventions for John over the years that he had me handle, but let's say we have a family member or a family who's concerned about a loved one who is a lawyer or a judge. Then what we would do is help them facilitate an intervention. And so we actually have in the past gone into people's homes, met with the family, helped them organize a formal sit-down family intervention. And those are extremely effective. I've never participated in one here in Idaho that the participant didn't go to treatment. And it's a loving process, and that process really involves everybody in the family expressing how that person's addiction, drug use, alcoholism has affected their life. Because addiction, at least I know for me and my drinking and drug use, it spilled over and affected everybody around me. And so it's an extremely loving and powerful process to walk into a room and see a room full of people that love you and care about you sitting around trying to save your life. It breaks through that denial and can cut through a lot of the shame and the guilt, and is a very reaffirming process. So the main message that I always convey on the phone to an attorney, because of that high risk of suicide, and I've worked with a number of attorneys, you know, I've been an addiction counselor for almost 20 years, and you know, most of the attorneys I've dealt with, there is a lot of shame, you know, along with alcohol and cocaine use, and we talk about it in there a little bit, that there are higher rates of cocaine use with attorneys, and I think it is because of that high workload. You know, anything that gives a little extra energy and added edge to continue working is a little more appealing to attorneys. So the key thing is that there is hope. Because of the high risk of suicide, I like to make sure they're safe, so I'll ask some general questions. Are you safe? Have you had any thoughts of hurting yourself? You know, do you have a support network? What does that look like? You know, those kind of questions. And then stress that there is hope. I share my personal experience with them because, you know, in a lot of our literature in the AA book and the NA book, it says, you know, the therapeutic value of one alcoholic helping another or addict helping another is without parallel. And I believe that, you know, and that's been my experience. I've talked to therapists for years before I got sober, but when one of them actually said, hey, you know what, I've been through this and here's the roadmap and this is how we get through it, there's hope. That meant a lot more to me. And so I think that's the first thing, you know, for me that really helps disarm any individual who's calling the LAP. I identify, like I said, the motivating factors, internal, external, whether it's partners, a firm, and then screen for resistance, like I said. The second thing I do on these calls is identify the need. So what is the need of this individual? Maybe it's not just drugs and alcohol. Maybe they have a history of trauma. Maybe they have a mental health concern that's been undiagnosed or untreated. So there's a lot of different things that I'll kind of screen for, and then what we do is provide a resource. And so year-round, you know, I go to various addiction conferences, addiction treatment conferences, visit programs, and there are a number of programs throughout the U.S. that really specialize in treating professionals, whether it's doctors, nurses, lawyers, whoever that may be, and then we'll point them towards those resources. So the first thing that, anyway, I'll get into that in the next slide, I think, but so we provide a list of callers providing several treatment programs, specializing in treatment for professionals, continually visiting these programs because there are changes in the programs, insurance needs, whether they're in network with certain insurance, out of network, cost changes, staff turnover. We have had people on our list that did great work and then all of a sudden they stopped doing great work, so we'll take them off the list and then we'll continue to assess and then add them back to the list when they're back up to par. Fourth, we navigate the admission process. So if somebody does go get evaluated, you know, and it says, hey, you need treatment, we're going to help them with that process, whether it's family concerns, employment concerns, they need, you know, verification that they're in treatment for their employer, whatever that is, we help with that process. So we provide a list of treatment centers that specialize in professional work, continually evaluating those. Programs range from $20,000 to $60,000. If that were a strict cash pay for treatment, that would be the price, but most of them will take insurance. So we do have some that are actually less than $20,000 that take insurance as well. But that would be if you paid for everything from beginning to end of the process. That's kind of the range you'd be looking at. 3-day professional evaluation. So I want to talk about that a little bit. Those cost $2,500 to $5,000 depending where you go. And so the reason this is so important is if I come, you know, I used to do outpatient evaluations all the time, and so it's easy for an individual to come in and kind of portray themselves, let's say they are resistant to treatment, to portray themselves in a favorable light for 90 minutes in front of me. But it's a little harder to do consistently for 3 days in front of a team of professionals who are continually assessing you. And there's a lot that goes into that evaluation. The team is kind of a multi-discipline approach where you have, you know, doctors, psychiatrists, therapists, all kinds of different professionals completing evaluations and tests on these individuals. And so you get a very comprehensive and complete treatment plan on the other end of that. One of the reasons we do that is also to screen for physical symptoms. So, you know, certain drugs have higher risk of seizures and other withdrawal complications. And so that's another piece of that that's very important. And then based on that 3-day evaluation, they will provide the treatment recommendations. So they will detail what that individual needs for everything, whether it's, dual diagnosis treatment for, say they have chronic depression, they're bipolar, early onset schizophrenia, whatever it is they got going on, they will actually provide treatment for all of the diagnoses. So biopsychosocial, complete history, physical workup as well, psychiatric, utilize a battery of screening tools. All evaluations are performed, like I said, by a team, and then that's considered best practice. So the Federation of Healthcare Professionals, the National Lawyer, all those different federations typically utilize a 3-day evaluation. So treatment recommendations, all treatment recommendations, we use what's called ASAM levels of care, so the American Society of Addiction Medicine. And real quick, I won't go too far down this rabbit hole because I could spend a lot of time here, but these are the levels of care. Typically, an individual will start at a 3.7. A 4.0 level of care is really intense medical, so that would be like a intense psychiatric unit, like the Menninger Clinic or something like that. That's not as common of a level of care unless you're on an extremely suicidal and a severe threat to yourself and others. So 3.7 is a typical detox inpatient medical level of care. That's where most patients start due to medical complications associated with their withdrawal symptoms. Next, you would go into 3.5, clinically managed high-intensity residential. Now, this is all done under one roof, those levels of care. So 3.7 would be, you would start in your detox. They're going to be taking your vitals every 30 minutes, checking more physical-type symptoms. 3.5, you'd be getting into more of the treatment, so the counseling, the therapy, group therapy, family counseling, all those components would be in 3.5. Low-intensity residential, that's not really applicable to this population. That's not a level of care that we refer to for professionals. But when they get out of treatment, they may partake in a 2.5 PHP program or partial hospitalization. And that would be like going to school, like going to college during the day. You would go to treatment, 9 hours a week, 30 hours a week. And then they would step you down to level 2.2, which is 9 hours a week. And that's intensive outpatient, and then titrate down to level 1 outpatient. So that's kind of the typical care, but most attorneys, when they go to treatment, they go to a 90-day inpatient treatment program, and then they're referred home to participate with therapy, seeing a psychiatrist, family counseling, any other components that are identified in their treatment. So most individuals with alcohol, especially opiates and sedatives, so benzodiazepines, Xanax, Valium, any of those, they're going to need detox. There's a high risk of seizure associated with alcohol. I had a doctor when I was in treatment say, if I have 10 heroin addicts in a room and I just leave them and don't medicate them, I'm going to come back to 10 mad heroin addicts. If I have 10 alcoholics in a room, I'm going to come back if I don't medicate them, and a few are going to be dead. And so there are actually more physical complications and risks with alcohol withdrawal than opiates. The gold standard, like I said, there was a study done in the 80s amongst recovering physicians, and they assessed all the different treatment modalities, whether it was long-term outpatient, and they went through all those. And the highest outcome rates were actually with a 90-day detox residential, and then with monitoring. And monitoring started out years ago, they did 3 years. And so now actually monitoring programs, most states have adopted a 5-year because they saw a lot of people fall off prior to getting 5 years clean and sober. And so they actually upped it, and the outcomes have actually improved greatly with the 5 years. After proper assessment, providers can treat substance use disorders in combination with mental health concerns. Participants are assessed at lower severity, may want outpatient services. This is pretty rare. By the time somebody gets bad enough to call us and actually seek help, it's rare that they're going to just go to an outpatient provider. And typically the way that works with ASAM is if they're diagnosed as a substance abuser or a substance dependent mild. And that's pretty rare. Participants are assessed and deemed not to have a problem. Again, that's less common, like I said. But the good thing about a 3-day evaluation is we actually have had people go to a 3-day evaluation, and they say, no, you're not an alcoholic, this is what's going on with you, and they identify some other issue. And then they'll refer them to the appropriate care when they come home, so psychiatrist, whatever that is. So it does happen sometimes, but again, it's pretty rare. So this is a generic treatment schedule. You know, if you go into treatment, you're going to get up 6, 7, go to breakfast, 7 a.m. therapeutic duties, 8 to 9, morning meditation, goal group, mindfulness, different things they do at that time usually. Then you have group therapy, or what's called process group. You go to lunch, and then after that they usually do more of an educational type series, some kind of exercise group. And then individual therapy sessions typically will happen either in the morning between that 8 to 9 or that 4 to 6 kind of period before dinner. Then you go to dinner, and then the evening AA groups, and then there's a wrap-up group, and then lights out. And that's the typical thing. Family groups will usually happen on weekends, things like that. And so the monitoring is what we actually do at Southworth Associates after treatment. And so somebody goes, they complete treatment, and then they come back, and the treatment center is going to give a aftercare plan that has a series of recommendations, such as, you know, it's pretty straightforward stuff. Abstain from drinking or using, continue to attend Alcoholics Anonymous or Narcotics Anonymous multiple times a week. I drank and used every day, so it made sense that I should go to an AA meeting every day after treatment, or an NA meeting, so that I didn't have a hard time wrapping my head around that, but sometimes people do. The best outcomes globally, and as we look at outcomes data, there's a lot of different outcomes data out there. I think some of it some of it can be subject to profit and gain depending what studies you're looking at. So I'm pretty picky on data, but you know, a lot of people think that Alcoholics Anonymous and Narcotics Anonymous do not track data, and they actually do. There are membership surveys that we complete voluntarily each year anonymously that you can do. On the NA website, there's a lot of data. AA website, there's tons of data. And it's all really good data because it's voluntary, it's anonymous. You know, there's no profiteering going on in Alcoholics Anonymous or Narcotics Anonymous, so I think it's pretty untainted data. So that's a lot of good data. And then monitored professionals have the highest success rates. Typically, if we look at a nursing program all the way to lawyers to doctors, we see it fall in the 60 to 80% success range. Currently, Southworth Associates, we are at a 77% range with our biggest program, which is our physicians. Nurses are typically our lowest success rate, and that's for a number of reasons I won't get into. And attorneys typically fall in the 70% range. So that's typically, they're right in the middle there with our program. That does vary nationally depending on the programs that are out there. The monitoring overview, real quick, just to show you what we do. The first step is advocacy and support, right? Everybody that calls us may not be an alcoholic. So the first step for us is really just kind of listening to them, making sure what's going on, and trying to get them to the resources they need. And then we'll advocate for them to get into treatment. If they have any barriers with that, let's say there was an attorney who wanted to go to treatment, but he was afraid his partners would turn on him, or we can help navigate those types of situations. I've gone in for friends that are involved in law firms and done education for their firms, so they can actually just see, hey, it is a brain disease, this is what's going on, it's not some kind of moral failing or weakness. So we'll actually do some of that stuff. Participants call into a phone line daily when they get back to do drug testing. And so this is a randomized system, and they would just call in, or we actually have an app that we're utilizing where they can check in and look and see if they're being called for a test that day. And then they would go in and produce a sample and go on their way. And the way this is really beneficial for them too, a lot of our participants report that it helped them regain trust in the family, because this is concrete data that shows that they are clean and sober, which is pretty powerful stuff. I didn't have that when I got out of treatment. It took 5 years. It wasn't until I got 5 years sober that my family came and saw me get a cake at an AA meeting, because that's how much damage I had done, and rebuilding that trust took that long. And so for these guys, it's really great for them to have that in their corner to say, hey, I'm getting drug tested randomly throughout the week. I've been clean and sober, and we will actually advocate for them with their families, their partners, whoever it is, and show them that data as they want us to. Documented 12-step attendance, so they have an attendance card that they'll take to meetings and just put in a basket. It gets signed. We have an app now that I'm testing. I'm not very good at it, but I'll go to a meeting and I'll log in and press that I'm there. And this is voluntary. They don't have to do this, but you would log in that you're there, and then you would push a button and it would say when you leave your meeting, and it'll actually verify that you've been at the meeting. So there's a lot of cool stuff that we're trying out now. And then meeting with a sponsor, and a sponsor is someone to take you through the 12 steps. And so we actually have them get a card signed for that as well. When warranted, therapy, family counseling, psychiatric and other adjunct support, trauma therapy, anything else that they'll need, we'll help them find resources. Here's the office number at top. So that's, 9 to 5 if you have questions, or you're welcome to call the office, or the cell phone's 24/7. So we get calls all throughout the night as well from people asking for help or asking questions. So that's the number to call. Any questions? Yeah.
Are there programs that you have available for people that really have no resources? A lot of times we'll get attorneys who are, by the time they call us, they're sleeping in their car.
Yeah. So what I'll do is, I have resources that we'll try and we'll call. I can't promise what state they'll be in, but I can find something for anybody pretty much. So if you send them to me, we're going to help them find something. So that's what we do.
Thank you. That was very interesting and informative.
Yeah.
With the evaluations, where are those conducted? Is that at the treatment center itself, or is there some other independent?
Yeah. So it can go either way. What'll happen is sometimes by the time most guys call, with attorneys, usually they'll call us and say they have a problem, and they won't want to do the 3-day eval. They're like, send me to treatment, I'm ready. And so we just forego that. They'll still get an evaluation when they get the treatment. It's just not quite as involved in it, and they get all that throughout treatment anyway. But typically what will happen is we have a separate list. So we do have a list of assessors and then a list of providers. There are providers that do the assessments as well, just because they have the staff, the training, and the know-how to work with these professionals. And so most of the time, where they do the evaluation, they will seek treatment. There are independent people that don't have treatment centers that do evaluations. Dr. Hartunian in Rancho Mirage, who's a good friend of mine, used to be the medical director at Betty Ford. He does them out of his office, and he's very well trained to do those. So there are some people that we use that don't have programs.
And it seems like the calls we receive here that we forward on to you typically are Monday morning.
Mm-hmm.
Is that what you see from your end? Are you getting calls 7 days a week, 24 hours?
We don't. I wouldn't say there's a pattern. I think people that call you on Monday morning, I think there's some of that to some extent of, hey, I had a rough weekend and I need help, but with the drugs, especially with alcohol, I think we see more of the Monday morning. With the amphetamines, the cocaine, the opiates, it's any time, any day. I mean, we see those calls. So.
Any other questions? Ben and Southworth are resources, so thank you, Ben.
Yeah.